I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
We're talking today about heart disease. Now, if you're just tuning in, heart disease is a series of multiple different things. Arrhythmias, arteriosclerosis, cardiomyopathy, congenital heart defects, hardening of the arteries in the heart itself, heart infections. So it's not a thing. It's a group of things that all fall under the category of heart disease. And so the first part of the show, and you can listen to it on the website, drjoe.com, just type in heart disease and hit enter and it'll be there. We talked about some of the more of a diagnosis and deciding what can cause these things. Now we're going to go into a little more about what you can do to prevent it. So we talked about smoking. I think we kind of ended the last half on smoking. If you smoke, you need to quit. It's about addiction. And so I spoke to Sierra, my producer, just at the first half of the show. We're going to do a show on addiction, on how to break addictions. And it'll be food and smoking and drugs and anything else you got. So we'll do a whole show on addiction on that and how it affects the brain, the dopamine receptor sites, the neurotransmitters. And it's really kind of a neat thing. And the biggest addiction, of course, is sugar. And we'll talk about how to break those sugar habits as well. I'm saying that now, so Sierra puts that together for me. All right, people with diabetes, of course. Listen to our show on diabetes, one of our top shows we've ever done. Diabetes, many cases, you can reduce or eliminate the need for most medications in type 2 diabetes with proper diet. Not all, but most. I've had many cases over the years follow our advice, and they said, my blood sugar is normal, I don't take medication anymore. So, again, I'm not saying stop your medication. I'm saying let's get you well enough so that you don't need the medication. That's our approach here at the show. People with diabetes may a higher risk of heart disease because blood glucose levels, if it's too high, can increase your risk of angina, which is heart pain, heart attack, stroke, hardening of the arteries. So if you have diabetes, it's essential to control your glucose and to limit your risk of developing heart disease. American Heart Association reports that people who have both high blood pressure and diabetes double their risk of cardiovascular disease. It's what we call comorbidity. You've probably heard the word comorbidity with COVID. Most people who get COVID survive. Most people who die from COVID have a comorbidity. They're weakened already from heart disease, diabetes, cancer, arteriosclerosis, obesity. And then the COVID comes in and it's just too overwhelming for the body. But guess what? That's any disease. That's the flu. That's a cold. You can eliminate a lot of the comorbidities by getting a normally functioning nervous system, normally functioning digestive system, and good nutrition. And so if you're taking medication, you need surgery, under medical care, please stick with that. Add what we're doing to your protocol. See if it works. If it doesn't work, so what? It didn't work. You ate some good food for a while. But if it works, which you probably will, then you'll say, okay, wow, this is exactly what I want, Dr. Joe. This is what I'm looking for in my life. And so it's free. The radio shows are free. Go to the website, drjoe.com. We have audios, we have videos. Take what you want and use the information you have. And if you have questions at that point, you can send them to me through the website, drjoe.com. I'm more than happy to answer your questions for you. Other risk factors that you can't control. You can control the nervous system, digestive system, and diet in most cases. You can't control family history, ethnicity, sex, and age. A male relative under 55 years old, such as a father or a brother who had heart disease, you have a higher risk. A female relative under 65, such as a mother or sister, you have to worry about that. So here's the thing. If you have a comorbidity, if you have a genetic predisposition, you got to be more careful than everybody else. It's just that simple. You got to be more careful. My father had heart disease. Now, he got it from rheumatic fever, but I got to be careful with that. If you come from a family of alcoholics, chances are you're more predisposed to alcoholism. I had a friend of mine who I disassociated with, unfortunately, but her father was an alcoholic, and she liked to have a glass of wine at night. And then she said, well, I'm going to have kombucha instead. We talked about kombucha at the break. Somebody had a question. Kombucha has alcohol in it. So she just couldn't stop the drinking. And it's really a shame because she didn't realize it was a problem. And so maybe you're one of those people. I like to have a beer at the end of the day. One beer isn't going to kill me. You're right. One beer isn't going to kill you. But one beer every day can increase your risk of comorbidities. and then we have more risk of getting something else. And now with COVID, I'm blown away that I seem to be the only person talking about taking care of yourself. We need a test. We need a vaccine. I get that. I'm fine with that. But let's also reverse those comorbidities. And if we can do that, chances are your chances go up pretty high of getting better and staying better. So how do we diagnose it? We can do blood tests. You can do a EKG or an ECG. That's where you monitor the heart's electrical activity. Echocardiogram is an ultrasound of the heart. It bounces sound waves off to see if it's working. A stress test, they get you hooked up and they put you on a treadmill. I've had a lot of these tests done, and it's a good idea to test it. Carotid ultrasound, they want to see if there's any hardening of the arteries in there. Again, you have carotid artery disease. What do they say? Well, we can go in there and kind of do like a Roto-Rooter and clean it out for you. Why don't we just stop doing the things that's causing the hardening of the arteries? Well, there's a novel idea, but that would mean you'd have to take some responsibility for it. And yeah, sometimes you have to take responsibility. Does it stink? Yeah, but you got to put on your big girl panties sometimes and deal with it. So if you have hardening the arteries, you have risk of hardening the arteries, stop doing the things that cause it. Smoking, bad foods, acid diet, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, all under your control. You can handle these things. Again, there's other tests you can do. I don't want to go into all those. You can do a catheterization. I remember my father had that done. They stuck a tube up in his groin area and sent it up to the heart. It was really kind of cool, and it saved his life. So again, there's nothing wrong with these things. If you've gone that far, you may have to do extreme measures. But let me tell you, my opinion, having open heart surgery is more extreme than giving up animal protein. Oh, I could never give up animal protein, Dr. Joe. Oh, no, that's too extreme for me. I don't know, get my chest ripped open, I think it's a little more extreme. So no downside to eating a good diet. And so that's what I don't understand. It's less expensive. It's better for you. You'll feel better. You lose weight. Your love life improves. Your breath freshens. Your hair, your eyes sparkle. Your hair shine. Your skin clears up. I don't get the downside of eating a good diet. I still, for the life of me, cannot comprehend why people poison themselves every single day. And I see it every day. And I don't know why. And you have control over that. If you don't know what to eat, go to our website, drjoe.com, and type in, "So what can I eat?" And we have a whole hour lecture that we did on breakfast, lunches, dinner, snacks. It's a great podcast, and you'll learn a whole lot about what to eat. And if you want to know what not to eat, type in the 7 deadly sins of nutrition, and we'll give you that as well. So what can you do? This is what we want to cover. Now you have to take control of your body. Lifestyle changes. Well, gee, that's a challenge, Dr. Joe. It can help treat the condition in so many different ways. Now, we talk about low sodium, low fat diet. That's a lot of fruits and vegetables that can lower your risk of heart disease. One example is a dietary approach to stop hypertension. It's called the DASH diet. What's the problem with the DASH diet? Well, the problem with all diets. Most people only get their iodine from salt. We're not eating sea vegetables. So you get your iodine from salt. You go on a low salt diet. You don't get enough iodine. That can affect thyroid function and immune function. And so, yes, go on a low salt diet. Absolutely, positively, 100%. I support that 100%. But I want to make sure you're getting iodine in your diet. So the best source of iodine is sea vegetables. How many of you eat sea vegetables on a regular basis? I can't imagine anyone's arm going up. Sea vegetables are things like seaweed. So maybe you have some sushi periodically. Of course, I hope veggie sushi with avocado. And you get a little bit of seaweed in there. That's great. When I made Dr. Joe's Super Greens and Dr. Joe's Essential Source, I added sea vegetables to it because I know that most people, that's a big nutrient that most people are deficient in. So I take Super Greens and Essential Source every day. They taste great. We have plain Super Greens and we have mint. I like the mint better. You can try the plain if you want. Doesn't matter to me. And I mix a scoop of each, Essential Source and Super Greens, and I take it with coconut milk, ramen milk, shake it up in a small jar and drink it. In the summer, I'll add like a frozen banana, some frozen berries, make like an ice cream out of it. And I can't imagine a day going by without Super Greens and Essential Source. We ran out of it a while ago with the COVID issue. We had a distribution issue. I was going nuts. We got it back in. That week, I cannot tell you how many emails we got on the website, drjoe.com. Oh my God, I feel great. I'm so glad it's back. This stuff is amazing. Don't ever run out again. We don't want to run out, believe me. So Super Greens and Essential Source, minimum supplements you should take every day, and they help solve this low salt issue because you're not getting iodine. And I agree, low salt is great. If you're going to do salt, make sure it's Himalayan salt, pink salt, Celtic salt. These salts have over 70 different minerals in them, very alkalizing to the system. The body needs these minerals that many times they're not going to get anywhere else, to trace minerals. So it's okay to use some salt, but you also got to make sure you're getting your iodine, because those the natural salts don't have iodine in them. So that's why you want to take the Super Greens, the essential source, for many reasons. Of course, there's medications you can take. If the doctor prescribes medication, do what the doctor says. Follow those medications, and let's get you well enough so that you don't need those medications. Surgery ultimately is sometimes necessary. My father had open heart surgery, kept him alive for another 20, 30 years. Good. That's awesome. But we want to do everything we can to prevent that. My father had rheumatic fever. Had he had his rheumatic fever treated when he was a child properly, chances are he wouldn't have had to have open heart surgery. And so it seems to be like, well, you need open heart surgery. No one ever says why. Why did I get this? What can I do to prevent it? What can I do now that I've had the open heart surgery? It's never really discussed. So you want to aim for good blood pressure and good cholesterol numbers. I don't think that's a rocket science to figure out. Go to our website, drjoe.com. Listen to the show on blood pressure we did. Just type in blood pressure, hit enter, it's there. We did a show on cholesterol. You could listen to that show as well. Really good information there. You got to manage stress. Now, when we talk about stress, there's chemical stress, physical stress, and emotional stress. Joking the other day, I bought a lottery ticket, and I said, boy, if I won, this would be great. What would I do with all the money, and blah, blah, blah. But then I thought, people that win the lottery oftentimes have mega amounts of stress. And then I thought, wow, if they should give coaching sessions if you win the lottery on how to deal with the stress. It's good stress sometimes, but it changes everything. Number one stress we have, according to Hans Selye, researcher out of Canada, number one stress we have is death of a loved one. I don't think anybody argues that point. Number two is moving. And when he said moving, he could be talking about moving to a new house, moving to a new job, moving to a new relationship, moving out of a relationship, divorce. These are some of the stressful things that we go through. And stress can increase your risk of heart disease. So physically, if you have neck pain, back pain, shoulder pain, numbness, tingling, muscle weakness, cold hands, cold feet, headaches, many cases respond extremely well to chiropractic care. So if you want to come see us, we're a team of chiropractors, and we have other professionals as well. We'd love to see you. So if you want to make an appointment, go to our website, drjoe.com, drjoe.com, and you can book it right online. Garrett has it all set up for you, really easy to do. We have offices in Marietta, Duluth, Stockbridge, and West Cobb, or you can call our office, 844-44-DR-JOE, 844-44-DRJOE, and that'll bring you through our offices, and you can make an appointment to see us. The initial visit was $375. We've reduced that to $149. And the reason we've done that is with COVID, I want people to get well. I don't want money to be the barrier as to why they're not coming in. We'll do an exam, x-rays, consultation, first visit. The follow-up visit, we'll go over the x-rays and discuss nutrition with you. All of that's included in the $149. When you decide to get further care, my staff will talk about your insurance. We accept most insurances, car accidents, sports injuries. If you've ever been in a car accident, if the car was damaged, you were damaged 100% of the time. You need to see us immediately. Be careful. There's a lot of scam doctors and scam lawyers out there. I don't want you falling prey to that. Come see us and let's get you well. So if you want to make an appointment, drjoe.com, and we can check things out for you. We can manage the physical stress in most cases. The digestive issues, if you have acid reflux, heartburn, burping, gas, bloating, many times we have to adjust the digestive system to make it work. So we can help with the digestive stress. And then the chemical stress you need to handle through nutrition, lifestyle, household issues, a new car smell, carpet cleaners, hairsprays, deodorants. There's chemical stress you can be putting on your body as well. So we want to address the chemical, the physical, and the emotional stress the best we can, and the digestive stress, and that's going to help reduce your risk of heart disease. And like I said, something even as big as hitting the lottery is a good stress, but people sometimes die after hitting the lottery. So I believe that if you do hit it, you should have to take a stress management course. And I think that's a really good idea. So remember, stress can come in many different ways. The healthy lifestyle, that's the number one thing that you can do to reduce the risk of heart disease. Quit smoking, control your blood pressure, exercise, maintain healthy cholesterol levels, lose weight if you're overweight, get healthy. Sounds great. But doc, I ain't quitting smoking. Doc, I ain't losing weight. Doc, I ain't giving up my sugar. Doc, I ain't going to exercise. Okay, that's why we do this show. We give you options on ways that you can manage your health crises that you're going through. So if it's obesity, listen to our show on obesity. If it's blood pressure, listen to our show on blood pressure. And then start taking some information. You don't have to do everything right at once. I wish you would, But you don't have to do everything at once. If you just give up artificial sweetener, wow, that's a big step. If you just get your digestive system fixed, wow, that's a big step. If you just take Dr. Joe's Super Greens and Dr. Joe's Essential Source as the minimum supplements you should take every day, that's a big step. Get your vitamin D levels normalized. That's a big step. So you can take little tiny steps, which really are really big steps, and be amazed at what happens. And so when you start doing these things, you'll say, like so many other patients do, why didn't I do this sooner? Dr. Joe, why didn't I do this sooner? And my answer is always, I don't know. Chiropractic care is the number one treatment for back pain. Most effective, least expensive treatment for most back pain. Why wouldn't you do it? Most effective, least expensive treatment for anything. Get my car changed, my oil changed in my car. That's what I would do. So if you have pain, you're wasting time by not making an appointment. Make an appointment right now. You can go to drjoe.com. 50% of heart attacks occur with people with normal cholesterol levels. So it's not so much the cholesterol that's floating around in your blood, it's the cholesterol that's stuck to the artery walls. That's the thing that's clogging up the arteries, the arteriosclerosis. So what you want to do is, when you get your blood work done, make sure you get a homocysteine test done as well, and a C-reactive protein. Homocysteine and C-reactive protein, add that to your blood work. Homocysteine, it tells you how much risk you have of oxidizing low-density lipoproteins to cause them to stick to the artery walls. I'm sorry, C-reactive protein is inflammation. The homocysteine is sticking to the artery wall. C-reactive protein is inflammation. You want to measure both of them. And so once you know that, even though your cholesterol level is normal, again, 50% of people die of heart attack with normal cholesterol, but they don't check their C-reactive protein and in most cases. Okay, the C-reactive protein and the homocysteine are so important. And that's why something like a cardiac ultrasound is really important to see if there is any clogging. Now, let's assume that I have hardening of the arteries and my heart is all clogged up, and I go in there, I get a double bypass, a triple bypass, a quadruple bypass, a quintuple bypass, and they unclog those arteries in my heart. They save my life. The cardiac surgeon is brilliant, and I mean that. That's not sarcasm. They're brilliant, these surgeons. What if I go back to the same lifestyle I used to have? What happens? Well, the arteries clog up again. So that's the kicker that I have trouble with, is why aren't we sitting down with these people? And some hospitals are and some doctors are. I'm not saying all. But why aren't they sitting down with these people and saying, okay, if you do what you did, you're going to have the exact same results. And next time we may not get it in time. So what do? Change your diet. Eat more fruits, vegetables, nuts, and seeds. Stay away from alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas. Make sure you have good circulation. As we get older, there's a nutrient in our body that diminishes dramatically, and it's called nitric oxide. Nitric oxide is in your blood vessel walls, and it opens up the blood vessel, allowing for smooth flow of the blood. Last week, we did a show on proton pump inhibitors and acid reflux, and we found out, if you listen to the show, that proton pump inhibitors reduce your amount of nitric oxide in your blood vessels, increasing your risk of heart disease. So now we're kind of segueing out of that show into this show. Nitric oxide is dropped when we don't get enough natural nitrates in our body. We get that from things like celery, fruits and vegetables. They give you nitrates. As we get older, our nitric oxide production drops anyway. So our number one supplements are Super Greens and Essential Source. They're the most popular supplements we have. The number two supplement is nitric oxide. Dr. Joe's nitric oxide support. It opens up the blood vessels. Now, I have to take my nitric oxide in the morning. If I take it at night, I can't sleep. I get so much energy. I'm like a rabbit. I'm running around crazy. The other day, I had a really busy day the day before, and then I was doing a lot of activity. I was hiking, and middle of the day, I just popped one more nitric oxide. Boom, my energy came back again. So, yeah, there's a lot of medicinal benefits, so to speak, for nitric oxide, but one of the benefits that you see right away is that you get a burst of energy. It opens up the blood flow to your brain, your reproductive organs. So many times as men and women get older, their love life starts to fade a little bit. I get a lot of reports coming in that when you take the nitric oxide, it helps. Now, one guy sent me an email and he says, Dr. Joe, I've taken it for several weeks now. I'm not seeing any changes. Almost like he was mad at me. I said, okay, that means it's not just a nitric oxide problem. Nitric oxide is not the end-all be-all. Nothing is the end-all be-all. So he came in as a patient, and sure enough, he had pinched nerves in his low back that were controlling his sex organs. He had clogged arteries that was controlling the blood supply to his sex organs. He was smoking. He had we checked him out, and he had bags under his eyes, and so we put him on adrenal support, and the adrenal glands help produce testosterone, because as you get old, testosterone levels drop. So don't think you're going to take one supplement and say, okay, Dr. Joe, it cures all my problems. Many times there's underlying issues that we have to deal with. So nitric oxide is great for opening up the blood vessels, and many times that can help reduce blood pressure. If you're on blood pressure medication, I want you to be careful. If you start taking nitric oxide, if the blood pressure gets too low, you got to be careful with that because the medication will lower it, and many times the nitric oxide will lower it as well. So just be careful with that. I don't want you getting sick from that or actually passing out, which can be a problem. More things we can do. Gosh, almost out of time. I got so much more to cover. Lifestyle changes. We'll cover a little bit more of this. This is some research from the Mayo Clinic. Guess what? Guess what they say? Eat more fruits and vegetables. What a novel concept. Avoid things like vegetables with cream sauces, fried and breaded vegetables. By the way, fried okra does not count as okra. Scotch and water does not count as water, okay? So I had okra, Dr. Joe, and tomatoes, and they were fried and green. And I was like, no, that's not what you want. Canned and packaged fruits, and especially in heavy syrup, it's sugar water, basically. If you're eating frozen fruit with added sugar. I remember when the smoothies became popular, and I remember going to a mall one day, and they had, I won't name the brand, and I bought one of their smoothies, and it was delicious, way better than any smoothie I ever made. And I thought, oh my gosh, what kind of magic ingredients is in this? What kind of drug did they put in this to make it taste so good? And then I looked up the ingredients, sugar, and some strawberries, I think, So no wonder it tasted so good. So you just got to be careful with that. Don't be duped into thinking that, fried green tomatoes are tomatoes, or that smoothies that have a lot of sugar are still sugar. Grain-wise, I do recommend you cut out wheat. Most people have a wheat allergy. They have an inflammatory reaction to wheat. And wheat's sugar anyway. So I would say cut out wheat. You can do quinoa. Quinoa is a grain. If you don't know what it is, it's from Peru. It has a really nice flavor to it. Sometimes in the fall and winter, as a real quick snack, I'll take some vegetable bouillon cubes. I'll throw some quinoa, boil it up, and just eat it. It's spectacular. And if I want to get crazy, I'll add some vegan cheese to it. Woohoo! But it's a real quick, easy snack. Really good for you. High in protein, lower in carbs, lots of fiber. Oatmeal is okay. People ask me all the time, what about oatmeal? I do recommend organic. There is a protein in oatmeal called avenin. Avenin is similar to gluten. So some people that are really super sensitive to gluten have a reaction to the avenin that's found in oats. So if you have a reaction to it, don't eat it. That's fine. So stay away from those things. Stay away from saturated fats, of course. That's animal fats, trans fats, processed fats. Don't eat it. Here's my rule on food. If you can't pronounce the ingredients, don't eat it. It's just that simple. The more packaging it has, the more ingredients it has, the less good it's going to be for you. So you want to really focus on more fruits, vegetables, nuts, and seeds. You can go to our website, drjoe.com. Listen to the show we did called So What Can I Eat? My first book that I wrote, Eating Right for the Health of It, is a really good guide. It has recipes in it. My second book, Prescription for Extreme Health, really it's like a step-by-step owner's manual that you can use for your own body. It's really a good book as well. So if you like reading books, we have books for you too. And that's the thing about the website. We have books, we have articles, we have audio, we have video, we have question and answer sessions, we have blogs. Whatever works best for you, I'm putting it all on the website so that you can pick and choose the best way that you learn. Different people learn different ways. I'm visual. I like seeing things. That's how I learn better. So if you have any questions, go to the website, drjoe.com, type in what you're looking for, and then chances are we've done something on that already. If not, then you can send us a question through the website. My staff and I will be more than happy to answer it for you. Follow us on Facebook and Instagram at Dr. Joe Esposito. Facebook, Instagram, and YouTube. So follow us, like us, subscribe at Dr. Joe Esposito. We're real close to being an influencer on Instagram, so we need your help. So please, everyone, share these links with your friends. We really want to get to be influencer level on Instagram. We need your help. If you want to make an appointment to come see us, and you should, neck pain, back pain, shoulder pain, digestive issues, nutritional concerns, headache, numbness, if you've ever been in a car accident, ever, if the car was damaged, you were damaged 100% of the time. You need to come see us. We have offices in Marietta, Duluth, Stockbridge, and West Cobb in the Atlanta area. You can book an appointment online, drjoe.com, or call us at 844-44-DR-JOE. The initial price was $375. Through COVID, we've reduced that initial visit to $149 so that people don't sacrifice their health. Exam, x-rays, consultation, first treatment, and next visit, going over the x-rays and nutrition, all that for $149. Then for future care, we accept most insurances. Folks, I'm Dr. Joe Esposito, drjoe.com. Thanks for tuning in. Tell your friends about the show. We'll catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.